award, of course, started in 1994, named after Dr. C. Everett Koop, who was one of the original founders of the Health Project. We are now approaching our 3 decades of providing the Koop Awards to applicants going back to the early 90s. And we've given about 75 or so awards to winners of the Koop Award. So in terms of who we are a 501c3, a nonprofit. We seek out exemplary workplace programs, identify best practices, promote, translate, and disseminate the lessons learned from these applications. What we do is we spotlight organizations with these exemplary programs by evaluating, providing feedback and recognition to them. And each of the applications which is submitted, and by the way, the application process is free of charge. Each application does receive feedback from our reviewers, which typically number 10 or more for each of the applications. Our objectives are to recognize private and public health promotion programs that have measurably improved the health and well-being of employees and their families, and have done so cost effectively. These employer-based programs have the objectives of improving population health by helping individuals change unhealthy behaviors and reduce their health risks, establish a culture of health at the workplace and surrounding community, and offering good value for the money spent invested in these programs. To be eligible, the program must employ comprehensive and evidence-based strategies designed to improve the health and well-being of the entire population and across the health continuum, have been in place for a minimum of 3 years, and be well integrated into the organization's infrastructure and yield significant improvement in population health and noteworthy business results. In short, the application must answer these 3 questions. What was done? Did it work? And was it worth it? Unlike other recognition programs, our award is heavily weighted on the basis of documenting results, health and business results. Over 60% of the scoring is focused on the methodology and the results of those analyses. Here's a cross-section of some of the winners over the last few years. You can see that some are private companies, some are public entities, school systems, and some are universities and medical care systems. This is our website, easy to remember, www.thehealthproject.com. And there you can find the application itself, information about us, how to apply for the award, and even summaries of winners of the award going back many, many years. You can actually, if you click on it, see their application and see the data that they provided in order to win the award. Importantly, when you're applying for the award, there's a checklist at the bottom before you even begin to make sure that you're applying the requirements of the award application. And that includes word limits, how information is being shared, the time horizon for the data, and other important pieces of information that should be checked for before submitting the application. Each year, annually, at the Hero Forum, which is in the fall, we recognize the winners and those earning honorable mention. These are some pictures of our board members as part of that Hero celebration. Here's some more of the detailed methods and results that we are looking for, and also some questions that we can answer beforehand. What we're looking for is program description of health and well-being strategies employed, top health issues that are addressed, and evidence of health improvement. We're looking for descriptions of the program evaluation methodology, results, highlighting where possible the connection between the measurable outcomes and the specific program elements. We're looking for documentation of improved health risk reduction, demonstration of business case and value for investing in the health and well-being of the population. Previously, we used to ask for ROI calculations, return on investment calculations. We're now asking for value on investment. So number of business and outcomes may be recordable and documentable. They may include medical cost savings, effects on absenteeism, effects on productivity, attraction, retention of talent, job satisfaction, and other variables that really are important to senior management of the organizations. We're looking for our very specific numbers on the number of participants, and if you're looking at cohorts, that is people who are being followed over time, what their numbers are, the ends, should be clearly labeled for each of the results included. Also, analyses on subpopulations should be described as such versus an overall eligible population, which may comprise the denominator. Here's some questions that we've had in the past. Are there minimum requirements for the application? In other words, are you looking for specific participation rates, risk reduction, outcomes, cost savings, and so forth? The answer is no, because we understand there are different organizations, different and unique challenges that they face. And they may have different results, but they may be appropriate and in fact admirable for their specific industry or company. What are the programs evaluated on? Again, adherence to evidence-based practices, comprehensiveness, participation rates, health improvement, risk reduction, and business outcomes. Are there requirements different for small and large organizations? Short answer is yes. Smaller organizations are not expected to do the kind of sophisticated analyses that large organizations can do. For example, if they can document cost stabilization over a 3 to 5 year period without any significant benefit plan designs or other utilization management program initiatives, that's often considered sufficient in terms of demonstrating cost savings. And in terms of what defines a small business, we have two categories. Small is under 1,000, and kind of a little bit larger, but not quite large, is between 1,000 and 2,000. Those organizations that are smaller or medium size do receive extra credit as part of their application. Does a published article serve as a gold standard? Yes, if it's informative of evaluation results, demonstrating the program impact. However, it's not a requirement. Is financial impact required, or is change in risk status utilization sufficient? Health behavior change, risk reduction is required, plus cost savings or some kind of impact on business. Are vendor reports as good as independent third-party analyses? Independent analyses, of course, have greater influence, but vendor reports will work if they are well documented in terms of methodology and are credible. What supporting materials required? Typically, we're again looking for tables, charts, graphs with ends, page numbers, clear annotations, statistics where appropriate. And finally, how are winners determined? The applications are sent out to the reviewers. They're independently reviewed and scored by the board members. And then the reviewers use their best judgment using specific criteria and greater emphasis based on program evaluation results. They assign a score to each of the applicants. Then all of these scores are averaged with and without the outliers. And then we all get together as a board and spend about 3 hours reviewing the applications and then voting once more on who should be designated a winner versus honorable mention. And with that, we'll open it up for questions.